evening. Welcome to the Guelph-Wellington Health Coalition. We welcome you and know that you'll enjoy our dynamic speaker, Marie-Claude Premont. And before we begin, there are a few housekeeping tips. Washrooms are available at the back and in the corners, and also in the basement. And please feel free to visit our tables because we do have handouts, pamphlets, things you can take away tonight that will help you to understand the issues, the many issues, and multi-layered problems of healthcare. Your free will offering tonight will help to offset the expense of this evening as well as continue our mission in the various venues in Guelph, and we are deeply grateful to you for this. In your packages, you probably already have found an agenda, a pencil, and some recipe cards to write down your questions as Ms. Premont is speaking. If you raise your cards, we have a couple of young people who are really anxious to pick them up. And those will be the cards that we use for question and answer session. When our presentation is finished, we'll have about a 10-minute break just so that we can organize those cards and give you some time to look at the tables, and then we'll resume and answer those questions first. So before I introduce Marie-Claude, I wish to read you a letter from our local MP, Frank Valerian, who wished to attend this evening's seminar. Dear friends, it is with sincere regret that I find myself unable to attend tonight's town hall meeting on the state of our healthcare system. My parliamentary duties require that I be in Ottawa. I would like to thank the Guelph-Wellington Health Coalition for its continued vigilance demonstrated in many ways, including events such as this one, designed to maintain transparency and accountability in healthcare, both vital components we must expect from a responsive and effective healthcare system. Overcoming the many challenges in our healthcare system continues to face, including the one which is the subject of tonight's discussion, require honest dialogue between all the stakeholders. Events like this provide a unique opportunity to hear and learn from experts in the field of public health administration, and to engage in the very dialogue that is required if we are to keep alert to the very events and incidents that threaten our healthcare system. Rather than allowing the immense pressures and constant challenges our health system faces to be an excuse to move towards privatization, we must consider them as a call to defend it. We must take heed of our options, stop its erosion, and work towards establishing the very best solutions necessary to maintain a healthcare system that is sustainable and continues to be the effective, accessible, universal health regime that Canadians expect. This is a fundamental pillar of our Canadian identity. In 2004, the Government of Canada signed the Public Health Accord, which injected $41.2 billion into our healthcare system. This accord sought to reduce wait times for key services, which include cancer treatment, heart surgery, MRIs, hip and joint replacements, and cataract surgery. It also sought to increase the number of doctors and nurses for communities across our country, expand home care, improve family care, implement a national drug strategy, and improve Aboriginal health care. The aspirational goals of the Accord have yet to be fully realized, notwithstanding that it is set to expire in 2014. To date, the current government has not yet clearly stated its position on renewing the Accord. It is imperative that the federal government take leadership on this very important issue, and in doing so, reassert a commitment to a publicly funded, universal, accessible system, included in the principles enunciated in the Canada Health Act. We need the dialogue from this town hall to be brought to Ottawa, to the health minister, to the prime minister, and frankly, to every member of parliament, so they know what matters to Canadians, and so that you expressed your values, that your expressed values serve as a guide to our government when making future decisions. I truly regret not being able to attend this very important town hall meeting, but hope to send your thoughts to other parliamentarians so that together we can protect, maintain, and improve a healthcare system well worth defending. Yours truly, Frank Valerian. Thank you. So as a result, I didn't write my speech. He said it all. I'll have to hire him. Now I would like to introduce you to Marie-Claude Premont. We received a very short bio from her, but we perceive her accomplishments to be very valuable. She is a law professor at the National School of Public Administration, a part of the University of Quebec. And prior to that, she taught at McGill University, where she held the position of Associate Dean of Graduate Studies in the Faculty of Law. She is a member of the Quebec Bar, as well as a member of the Professional Engineers Corporation of Quebec. She teaches and does research in the field of health law and municipal governance. She has been closely following the impact on Quebec public policy and health of the Chaoulli 2005 Supreme Court decision concerning private health insurance and delivery. And her writing has been published in the Devoir and the Star. May I introduce you to Marie-Claude Premont.
Good evening. Thank you, Mick, for this introduction and for the close presence of your member of parliament. I'm really happy to be with you tonight. I was asked to share with you some of my thoughts concerning the current threats to Medicare in Canada. And maybe many of you have heard about the Chaoulli decision, which is a Supreme Court decision, which came down in 2005, which concerned directly Quebec legislation. Of course, it's been, talked about across Canada, but I feel that maybe people thought afterwards, well, that concerns only Quebec. It doesn't concern us in Ontario or in BC or Saskatchewan, whatever. And I think that would be wrong to think that way, because we're all in the same boat about when it comes to Medicare. In spite of the fact that the main jurisdiction of healthcare lies with provinces, you know that we have the Canada Health Act, which acts as an umbrella legislation sort of thing for Canada. But mainly what is happening in Quebec is